physicians in their communities. And we'll bring it out to an even broader group by saying that our purpose is to educate physicians and their office staff about breastfeeding. This grant is from the Indiana State Department of Health Maternal Child Health Division. And this webinar today is being brought to you by Indiana Perinatal Network in collaboration with the Indiana Breastfeeding Coalition. And we are partnering with the Indiana Rural Health Association. So a lot of great partners coming together to work on this exciting project. Today's call offers continuing medical education units, and just to review the objectives for you, the participants of the 4-part series should be able to recognize the importance of breastfeeding for babies, mothers, and society. They should know the evidence and policies and practices behind supporting breastfeeding. They should know the management of common breastfeeding problems and how to set up a breastfeeding-friendly medical practice, and as well as utilize the community support that's out there. We will be concentrating on the first, second, and fourth objectives in today's call. I do want to say that as the speaker today, I have received no commercial support that would influence the material that I'm presenting today. So today, we're really going to be looking, the topic of today's call is lactation support services and community resources. So we're really going to be looking at collaborating together and utilizing what's out there in your community to improve the support that we're giving to our families for breastfeeding. And as you know, my name is Tina Cardarelli. I'm the Indiana State Breastfeeding Coordinator, but I'm also the Director of Breastfeeding Services at Indiana Perinatal Network and the Breastfeeding Coalition. And in that role, I've been in doing this work for about 8 years in the state. And I think it's helpful to know that I've just been going around to communities, visiting hospitals, doctors' offices, community programs, going to community events, trying to figure out where the assets are and where the deficits are in communities all over our state. And I think that I have learned a lot from everyone working out there about what's needed, what we're doing really great at. And so I'm going to try to give you an overview of what you might expect to find in your communities to help you in the work that you're doing. So let's start with a little bit of background, a little bit of history. The Kellogg Foundation, they have been a very instrumental foundation in promoting breastfeeding in the last probably 6 or 7 years in this country. And they recently did a very good survey where they asked people if their intention to breastfeed, and they found out that over 80% of women strongly desire to breastfeed. That was even surprising to me, and I've worked in this field for about 3 decades in 3 different states. But I think that if you look at the number of women that start breastfeeding, it proves what the Kellogg survey showed. So nationally, over 80% of women begin breastfeeding. So in the first couple of days in the hospital, 80% of these babies are coming to the breast. But what we're going to be talking about today is how quickly this falls off when they are discharged from the hospital and get out into the community. And we're going to be looking at the kinds of support that these women need so that these numbers do not fall off, as you're seeing in this chart. Now, this chart is in a very recent document that was put out by the CDC that you can find on their website online. And I've put the link here on the bottom left. So every month, the CDC produces documents called vital signs on various health issues. And this past October, they produced a great document looking at pretty much the state of breastfeeding, and this particular chart was in there, so it's has great information if you want to look into that a little bit more. So I'd like to talk a little bit to set the stage for what we're going to be talking about today. I'll start with Kellogg, who I referred to. And so I just read last week that Kellogg in the last 6 years has funded over $50 million to improve breastfeeding in this country. And so they're a big player in moving the ball forward. And I love what Dr. Gail Christopher said. She's the VP of the foundation. She said, if we truly understand that breast milk is the best first food for babies, and our polling shows Americans do, then our institutions and communities need to make it easier for all mothers to nurse. We believe whether a woman breastfeeds shouldn't be dictated by the quality of health care she receives. And so that really is like focusing what we're going to be talking about today is how can we assure that women are getting the quality health care they need to succeed. This is a very good socio-ecological model of the people who impact breastfeeding. It was included in the Surgeon General's Call to Action in 2011, but it comes from a study that was looking at organizations that impact breastfeeding success. And you can see by the circles here that local offices, clinics, healthcare professionals, doctor's office, healthcare systems, like are right there in the hot zone of supporting breastfeeding success. I'm going to be referring today to two documents that are very important, and they're pretty much going to set the framework of how I'm going to be addressing the community topics. And so the first is the 2011 Surgeon General's Call to Action to support breastfeeding. And this was quite a game changer when the former Surgeon General Regina Benjamin produced this document. And she had 20 action steps for what the community needed to do to give families what they needed to do to support women and families to breastfeed. The other document I'm going to be talking about is a recent document that came out by the CDC that is a really good resource. It's the CDC's Guide to Strategies to Support Breastfeeding Moms and Babies. And it has just pages of evidence-based interventional strategies that you could either use on the state level or for your purposes for the community level. It allows you to choose what meets your needs in the community, and it also gives some great examples, and you can get this online at the website below. So let's talk a little bit about these community strategies. And so in the CDC guide, they outlined 7 strategies to improve community support for breastfeeding. So first, we're going to look at improving hospital services or maternity care practices, and we're going to look at what's going on in the hospital. We're going to look at what's out there, and I'll give you some examples of professional education. We're going to look at access to professional support by families, access to peer support, breastfeeding in the workplace, breastfeeding in early care and education, breastfeeding education and information that you have available to your patients. I guess in this day and age, you can't really talk about community strategies without talking a bit about social marketing. And the CDC included as number 9, marketing of infant formula. And we'll talk a little bit about the influence of infant formula on the work that we're doing. I want you to really think about your particular community as we review these, and think about your assets and think about your deficits. Think about what your community does really well or what you think is missing from your community. And what I really want to get across is that today we're not asking the physician offices to do everything. We know that There's just so many boxes to check in the jobs that you're doing. And what I hope from this call is that you'll really begin to see what you can tap into that already exists in your community and the organizations that you could partner with or reach out to. So let's look first at maternity care practices and what's going on in the hospitals with their quality improvement initiatives. And so the hospitals have been kind of a hotbed of activity around improving breastfeeding services. And so many of you have heard of baby-friendly designation. And so baby-friendly designation, just a little bit of background about that. It's an international designation. It began in 2001. It was a result of a very important worldwide meeting that happened in Italy in the summer of 2000. That looked at reducing infant mortality worldwide. So in 2000, they were having a huge problem worldwide with infant mortality, and all the big players came to Italy to really look at the problems. So we had World Health Organization, we had UNICEF there, and what came out of that meeting was the Innocente Declaration, which said that if we really wanted to impact infant mortality and reduce it, we needed to protect, promote, and support breastfeeding. And what happened is UNICEF, World Health Organization came up the following year with the baby-friendly designation, which was 10 steps that hospitals could do worldwide to support breastfeeding and to make sure that women were likely to succeed in the hospital with breastfeeding. So we have almost 30,000 baby-friendly hospitals around the world. We have just a couple hundred in this country, but the hospitals are very, very quickly in this country becoming baby-friendly. So I want you to know where this baby-friendly designation came from. It's a worldwide designation. I often hear when I travel around communities, oh, we should call it something different, or like, did this health department make this designation up? No, this is, something that, you could go to some countries and every hospital is baby-friendly, and that's what we hope these hospitals in this country will look like very soon. We expect by the end of 2016, Baby Friendly said last week in a webinar that 20% of all births in this country will be in a baby-friendly hospital by December of this year. So it's very quickly moving. And so we'll talk a little bit about what that means to the hospital. There's another quality improvement process in place that is coming out of the CDC, and it's called MPINC. And we have made a big deal in this state talking about MPINC. And so it stands for Maternity Practices in Infant Nutrition Care. And it is a QI process to move the hospitals, or a survey. It's really a worksheet. The hospitals take the survey one year and they get the results back the next. The results are confidential to the hospital, and so it's really to help the hospitals to move to evidence-based care around infant nutrition care. We just filled out the survey at the end of 2015, and we are awaiting the survey results probably late summer or fall. What I want to tell you is that the hospitals in Indiana have done an amazing job. So they were a bit below the national standards when this survey came out in 2007, and they have continued to rise every year. So we were getting what I would tell you is a D. It was in the low 60s. And in 2013, our MPINC survey statewide was a 76, which went above the national average. So our hospitals have been working very, very hard to implement these practices. Now, if you look at MPINC's survey, there's 39 practices, and they pretty much are the broken down steps of baby-friendly practices. So whether a hospital is working on baby-friendly, formally on baby-friendly, or they're just trying to improve their practices through working the MPINC survey, it's basically going to lead them to the same point. And you could view what the survey looks like at this website. There's a third practice that's very much influencing the hospitals, and that's the Joint Commission Exclusive Breastfeeding Core Measure. So a couple of years ago, the Joint Commission required hospitals to really track how many babies are receiving breast milk, and so that has very much pushed hospital practices. Let's look a little bit more depth at what baby-friendly looks like in the hospital and what 10 steps that the hospital needs to do to achieve baby-friendly designation. First, they have to have a written policy that they routinely communicate to their staff. They need to train all healthcare staff in the skills necessary to implement the policy. And so that generally requires that nursing staff requires about 15 hours of education to re-educate their staff. Physicians around 3 hours. And then all the other departments in the hospital have a small amount of training as well. They need to inform all pregnant women about the benefits and management of breastfeeding. 4 is they need to help mothers initiate breastfeeding within 1 hour of birth, and that would be called kangaroo care or skin to skin. Hospitals have made tremendous progress with this particular step. They need to show mothers how to breastfeed and how to maintain lactation even if they're separated from their infants. Step 6 is to give infants no food or drink other than breast milk unless medically indicated, and you can see where that ties into the Joint Commission core measure. 7 is practice rooming in, allowing mothers and infants to stay together, and we've seen many hospital nurseries change over to procedure rooms or actually close, and we're doing couplet care, and that is really happening at a very fast rate around the state as we have observed. Number 8 is encourage breastfeeding on demand. And so you used to see that mothers would be told every 2 to 3 hours or 8 to 12 times in a 24-hour period. And so the focus is more on teaching the mother to recognize when a baby is hungry and feeding more on demand and not by the clock. Number 9 is no pacifiers or artificial nipples to breastfeeding infants in the hospital. We want these mothers to be able to understand what feeding cues look like from a baby, and we don't want them to get distracted by using pacifiers or other nipples. And 10 is to foster the establishment of breastfeeding support groups and refer mothers to them at discharge from the hospital. And so the hospitals are really being asked, like, where are you sending your mothers to when you discharge them? Like, what support is out there once they walk out of your door? And I have seen the hospitals really get engaged around this and trying to figure out solutions and partnering with their community to make sure that that care remains consistent. I'm going to move back a little bit and say that step 3 and step 10 are the 2 steps that have a strong community component. So in step 3, informing all pregnant women about the benefits and management of breastfeeding, the hospitals know they need help with this, and they know that the women need to come into the hospital with a basic understanding, at least to expect skin to skin following birth, to expect rooming in, to know a little bit about the benefits of breastfeeding when they get them in the hospital. So prior to them delivering, there's this understanding that the community is going to raise up and help these mothers to learn what they need to know about breastfeeding. And the hospital will take it from there, and then at step 10, the hospital releases the mom back into the community and what's available there. So we're going to look a little bit at step 3 and step 10. So it's clear that as we have improved our evidence-based care in the hospital, and we have improved our evidence-based care in the hospital, this is, you know, the hospitals are working very hard out there, that it has led to an enhancement and expansion of community breastfeeding services. And that is where these calls are coming in. Hopefully these calls will spur a lot of growth and us to really look at the services that you're providing and how we can do that better. So let's look a little bit. As we said, step 3 is building their care. They're going to build their care in the hospital on the prenatal services that the woman has gotten prior to admission. And then after discharge, those first few days are very, very, very critical. And so anybody that's ever worked in breastfeeding or that knows anything about breastfeeding knows that day 3 through day 7, any manner of things can go wrong. And we need to make sure that our women are being intervened with very early and in those first days, and no one's falling through the cracks. And so we're going to look at things like referrals and weight checks and clinics and classes and phone calls and even a program that we've piloted in Indiana, Lactation, where women can go to centers where there's computers and actually telecommunicate with board certified lactation consultants. So just ways of making sure that no woman doesn't receive the services that she needs to succeed. A little bit about professional education. And so there's a lot that is discussed in the CDC booklet that just references about what's out there to improve your level of understanding about breastfeeding. And so in the Surgeon General's call to action, step 9, she says, provide breastfeeding education and training for all health professionals who care for women and children. And that is where EPIC grew out of. And EPIC is in many states, and they run programs in different ways. They don't all look like the Indiana program. Some are online, some are in person. And they're just ways to help healthcare professionals get more education about breastfeeding. So she says 2 steps that we can do is to improve existing content and to increase our opportunities. And that is what we're doing today. A couple of things that I think might be helpful if you're looking for additional places to go for education. WellStart International has a wonderful provider training. I think it's still free. It's been free for many years. The School of Public Health at University of Albany, New York, has a free training that was developed with CDC funds. It's excellent. I often help hook doctors up with communities that request a doctor that's very skilled in breastfeeding to come and do a local grand rounds. That might be something, if that hasn't happened in your community, that would be really beneficial. There's also, too, we have some local lactation consultants that will come and do trainings in the doctor's offices, and you could contact your hospital or your local coalition. At Indiana Perinatal Network, we have a breastfeeding newsletter that comes out with a lot of good resources, clinical updates. It's a really quick way to get your office staff pretty much to give them a lot of information in very little time. The link is there to get the current newsletter and archived versions. We also have a monthly webinar at Indiana Perinatal Network. It's on the 3rd Tuesday of every month. It looks at clinical and community topics for breastfeeding. 5 of those calls this year will give continuing education units, and that might be something to check out. We're very excited about the annual breastfeeding conference that we will be having in Indianapolis on August 26th. And we are very happy to see people attend that are from doctors' offices. And we think that that's a great way to connect up with the community. So access to professional support. So the thing that I have set up here is that the short hospital stays and then the multiple quality improvement efforts that these hospitals are engaged in have really shifted the responsibility for breastfeeding from the hospital to multiple partners. And one of those partners is our international board certified lactation consultants. So that's that international certification, and it's called IBCLC. And in some of our larger communities, we have a lot of IBCLCs that you can access in person, but in some of our smaller communities, that might have to happen with telelactation, by telephone, or possibly in a group setting. And then one of the things that I would like to bring up is licensure. And so Affordable Care Act really looks, you know, of course, at preventable care, and lactation is seen as as really like the ultimate preventable activity or behavior. So what has to happen is that we can bill for lactation services, but we cannot bill in many of the states because board certified lactation consultants are not licensed to practice. So we have a licensure task force in this state, and we're working on trying to figure out how to get licensure. In the meantime, of course, physicians can bill for lactation services, nurse practitioners can, and an IBCLC that is an RN can bill for lactation services. And so I think that we are seeing several successful models around the state of doctors' offices that are billing for lactation services, and we can get you more information about that should you require it or be interested in that. So access to professional support in your community, possibly your hospital lactation services offer some kind of outpatient opportunities, or I don't know if your physician office or other physician offices offer opportunities to come in for lactation care. I've seen some doctor's offices that will have the local lactation consultant come in 1 day a week, or in some situations come in the waiting room. And so there's a lot of different models for this. And also too, you can access IBCLCs and also paraprofessional lactation consultants at the WIC program, at local health departments. Nurse Family Partnership does a great job of supporting breastfeeding and in-other in-home services. Coalitions are very helpful. Some coalitions have drop-in centers, or they can just be a clearinghouse for helping people to get to the services that they need. We have a really interesting business model for lactation support with a program that we've been working with Walgreens to do Well Babies at Walgreens, and I'll talk a little bit about that. So there's unique or discrete projects you can work on with local partners that would be unlike any other community. So, I would ask you, do you have ideas for how you can expand professional services in your community? The Walgreens program is a partnership it started with a partnership with Indiana Perinatal Network and Walgreens to open breastfeeding drop-in centers where women could go have their babies weighed, ask feeding questions, ask the pharmacist questions, and it has grown into 2 Walgreens. We're hoping to expand it to a 3rd, and they're now in a partnership with St. Vincent's Hospital, and St. Vincent's staffs the clinic as part of their outpatient. So it kind of shows a model of what can be done in looking at various partners and you know, what's possible in your community. This is another model of a drop-in center that's in downtown Indianapolis that just started. A lactation consultant from the hospital had a dream of opening up a place where women could go for free care, and it has just expanded over the last couple of years by leaps and bounds, and they actually see dozens and dozens of women every night that they're open. And so that gives you another model for care in the community. Peer support programs. This happens to be a picture of a drop-in center that I walked into that was pretty busy in Elkhart, Indiana. So out there you will find organizations like La Leche League. Does your community have a La Leche League? If you're not unsure of that, that's a great place to refer your moms. You can check out La Leche League of Indiana to find out where groups are. Breastfeeding USA is another group that is a little newer than La Leche League, but similar. It's a mom-to-mom support group. See if your community has one of these groups. It would be great to know to refer your moms out to. Do you have drop-in centers in your community? How do your patients access the WIC program? Are they eligible for the WIC program? How do they get hooked up with a peer counselor? We've also seen many church groups in churches, faith-based groups. We have seen many of our coalitions have groups, and we know a lot of workplaces provide support groups. So there are a lot of great models there. So these are just some other places where people can go find grassroots support for breastfeeding. Support for breastfeeding in the workplace. It becomes more and more of a complex problem all of the time for what to know what to do for women who are working to make sure that they're supported adequately. So let's look a little bit at the Indiana law that supports women. So there's 2 different laws. There's a law that says that a woman can breastfeed her child anywhere that she is allowed to be. And then there was a law that was passed in 2008 that supported working women. And so just to break that down a little bit is if you're a state or a government entity, you need to provide a reasonable paid break for the mom to express her milk, and you need to provide a private room that's not a toilet stall. Now, the way that government and political entities differ from private employers is that there's a cap on private employers. So you don't have to comply with the law if you have less than 25 employees, and you do not have to provide a paid break. And again, it needs to be a private location, not a toilet stall. Now in 2010, 2 years after our state law was passed, there was a national law passed that required employers to give break time to hourly paid workers. So I get asked very often, why just hourly wage employees? And the reason is that they were fearful that the law would not get passed if it was for all women, and they were very much aware that they wanted to protect the women who are most vulnerable in the workplace. And so they were willing to make concessions to make that hourly wage earners only. And there are a few salaried employees that are in that law as well, but very few. And And it's similar to our line that it says a reasonable amount of time in a private space other than a bathroom, but it does put a cap on the amount of time that an employer needs to accommodate the woman, and that is up to the first birthday. They are hoping, or I think they are in the process of amending the law to include all women now, and there's been also some additions to the law very recently. A couple of good resources if you are helping patients who are working and and they want to know their rights. They want to know specific things you need to know when you're returning to work and breastfeeding, pumping information, how to speak to your manager, what's a reasonable accommodation, those kinds of things. This is a great resource called the Business Case for Breastfeeding, and the link is here that you can provide to your patients. The most recent and really best information that's out there for businesses and for employees is you can be found on the womenshealth.gov, and it actually is a place where employers can go when they think it's difficult to accommodate a working woman and really look at businesses that look like them. So there's an algorithm there where they type in some specifics about their business, and it will show them a similar business that has similar barriers in how they were able to accommodate their women. And we have many examples of Indiana businesses there, Walgreens being one of them, Goodwill Industries being another. Our Evansville Zoo is there as an example. There's actually little videos about those employers on this website, so it's a pretty interesting place to check out. Everything a mom or an employer would need. And sometimes it helps with your patients if the mom is struggling at work to give the mom a resource that she can give to the employer, and let the employer get a little bit of education about how to provide this accommodation. So the sixth thing that we're looking at is supporting breastfeeding in early care and in education. And two things I'm very proud of in Indiana is that we've done a lot of work in both of these areas, and that the work that we've done and the resources that we have are available to you in your communities. And so one program is called We Care for Breastfed Babies, and you can see these are all pictures of moms and babies and child care workers and Indiana child cares. And so we have come up with some resources. One is we asked child care what the #1 thing they needed and their parents needed, and they said a quick, kind of like a handy dandy resource guide where they could check on just simple tips for handling breast milk, storage guidelines, and nuances of a breastfed baby. And so we have this in our reference card, and I think we've now to date given 12,000 of them out. This is a great thing to give to your patients or to have in your community, and moms love it. We get many requests for it. So this was a resource developed for child cares. This is a designation, the We Care for Breastfed Baby designation. One of the things I wanted to show you is the decal on the left is the universal breastfeeding image, and that can be seen all over the world. And so we have a lot of communities that are doing programs where they're designating restaurants and businesses with this decal so that people know that breastfeeding is welcome there. The picture on the right, I just happened to be walking into a health department that housed childcare, and I saw our decal on the window, so I just had to take a picture of it. You can go on to indianaperinatal.org and below and go into the childcare section, and you can see PowerPoint trainings, short 3-minute videos that your moms can look at or the childcare providers can look at. I would think the best resource there is a 3-minute video that you could send the mom to, and it pretty much tells her everything she needs to know in 3 minutes to return to work and leave her baby in the child care setting, and that would be a very helpful resource. This is the page that that link will take you to, where you can see the different resources that are available. The other supportive thing that a community should have in place is supporting breastfeeding and education. Again, we're really proud to have worked on a Kellogg grant in the last 3 years that have supported schools around Indiana to do two things: to be more supportive of their teen moms. You see a poster here that we've made available to the schools around Indiana. And the second thing is to teach breastfeeding in the secondary schools, and there's a curriculum for that, and I will show you the link. This happens to be a very successful program for teen moms, where they come to school and bring their babies with them. And we just took a picture of it when we went up to talk about breastfeeding with the moms. And breastfeeding is just integrated into what they do, and pretty much every mom in the program does breastfeed, and it's just a model that I wish was replicated in every community. It seems to work. So these are your two resources. Life Breastfed Beginnings is a curriculum for secondary education, and it's great. It has 10 lesson plans the teacher can pick from. They're fun, interactive activities to really teach younger people early in their life about the importance of breastfeeding to their health. And so that's available to you. That was developed by the Marion County Health Department, and I would just like to see it get out there to more schools. We have done some surveys with family and consumer science teachers, and they all see a need for teaching this, and so it'd be great to get this out and about a little bit more. Also, too, there is a teen resource page for working with teen moms to breastfeed, and that as well, here's the link on the Indiana Perinatal Network website. Access to breastfeeding education information. This picture again is of the drop-in center I told you about. And this is Kathy McCoy in the picture. She's a longtime nurse lactation consultant that opened this drop-in center, free care center up in the Catholic Center downtown in Indianapolis. And as I tell you, it's a hop-in place. So we know that there's a need for more education, more care, and more help for women to succeed at breastfeeding. Okay, so the goals of our education, the information that we give out, should be to help families see breastfeeding as normal, and there's a really big push to include dads more in the education that we are giving. We now know by studies that happen as when the dad's educated, the mom, again, is more likely to have breastfeeding success. We want to develop positive attitudes about breastfeeding, and we want consistent and cohesive messaging. And so I saw a survey that was done recently that said the #1 confusing thing to parents is that the messaging is all over the board and it's not really consistent. So they kind of are in the point of they don't know what to believe. So when I talk with physician offices, I really try to keep the messaging really simple and that pretty much the same 4 or 5 messages that really will help the person transition into the hospital, then let the hospital take it from there. There was a very good Cochrane review that looked at breastfeeding education. I know it's an older study in 2005, but it's found out that personalized education is extremely effective, particularly with the millennials that we're dealing with that really want things, they can Google anything, so they want things very specific to their needs, that printed materials alone have no effect, and that combining personalized and printed materials increase initiation and duration. And so it's not just enough to give our patients a pamphlet on breastfeeding or a booklet on breastfeeding. We know we really have to increase our care of our breastfeeding patients. Social marketing. So a study that was done that I've cited here shows that 86% of Americans turn to their health professional as their primary source of information. That's awesome. We know that. That's why we're doing what we're doing today. We want to give you more resources to tap into. What I've seen a little bit, and I've been Googling around to some doctors' offices, is that a few of them have breastfeeding blogs, that they have increased their breastfeeding information on social media, and that many of them have breastfeeding information on their websites. So when you really think about that, over 80% of women say that their desire is to breastfeed. The vast majority of women are looking for doctors' offices that support breastfeeding and putting basic breastfeeding information up on the website. When I've contacted those offices, they feel that's a real plus. This is one website, Northport Pediatrics, north of Indianapolis, that had quite a really extensive area on their website to help with basic understanding with breastfeeding. So just an example there. So addressing the marketing of infant formula. So in the there was a study done that showed that the marketing of infant formula reduces breastfeeding exclusivity by 39% during the first, by 6 weeks of life. And so we know that it's detrimental when a woman is trying to breastfeed to have, formula right at her fingertips. But we also know that there are very real reasons why physician offices need formula. And so it's exciting to see pretty much the doctor's offices not sampling formula, but using it very thoughtfully with the patients that need it, and that is the best case scenario. So the Surgeon General said in her call to action in 2011 that we must ensure that healthcare clinicians do not serve as advertisers for infant formula in order to avoid undermining breastfeeding. And in 2012, the AAP adopted a resolution to counter this practice. They advised pediatricians not to provide formula company gift bags, coupons, or industry-authored handouts to the parents of the newborns and infants in the office and clinic setting. So, it's just like we're trying hard. I was in a doctor's office recently, and they had some really nice visuals on the wall, and they were really proud of it. And they're just like, we've worked really hard to create a very baby-friendly or breastfeeding-friendly environment for our patients, and we've been very thoughtful about it. And I really appreciated it, except when I went to their wall pocket, I noticed that many of the handouts were produced by formula companies. And so just to really take a thoughtful look around your offices and make sure that it's sending the right message. There's also Citizens Action Group, who, are lobbyists that work in behalf of citizens. They have actually taken on formula marketing, and they have a lot of fact sheets on their website that are very helpful and very good for the consumer. This is another drop-in center in Elkhart, Indiana, Motherhood and More, started by 3 nurse lactation consultants during the recession and Elkhart when the RV industry was hit particularly hard, and it is just a booming place. I mean, lines of women waiting to come in, so it's quite an addition to that community. So a little bit off of the goals of today, I do want to talk a little bit about referrals and collaborations. So where do you routinely refer out to? Are patients being referred to you for breastfeeding help? If not, why? How can you expand your network? Do you have the referral information that you need in your community? I was up in Northwest Indiana recently at a community meeting, and there was a physician at the meeting, and I asked, like, what's the one thing that we could do to help you to do the work that you do? And she's like, get me accurate referral information that I can have at my fingertips, because that's just vital. And so, you know, I took that very seriously. I know the Indiana Breastfeeding Coalition is working on a community by community resource list, and I hope that we could get that completed this year and get that out there to everyone. Another important question to ask is there a local coalition in your community? Because coalitions are looking to be great resources to you and want to know how they can help you to do what you do. And so you might want to make a connection. I have been at a few coalition meetings where there have been doctor's office representatives at the coalition meetings, and that's always great when that happens. And so it'd be nice. I'm sure a member of the coalition would like to come and meet the people on your staff as well. How is your community talking to each other? And so I know on the second call of this series that we had a nurse from Southern Indiana Pediatrics talking about all the people that they refer out to and talk to and use as resources, and that's a really great model of care for every community to look at what they've done in their community. And again, a reminder of how important those first few days are to breastfeeding success. A couple of great helpful websites. If your moms are not signed up for Text for Baby, that's a great thing, national program. Also to two really well vetted websites are Breastfeeding Made Simple and Kelly Mom. I would think that Kelly Mom is the most visited website, and you can always be sure that the information there is correct and accurate. So how does your community support your patients, and what does your community look like? And at the beginning of this talk, I really asked you to think about what, if you took a community snapshot, what that would look like and who the players are and what's missing and what's really good in your community. I have to refer to this picture because I went to a very small community in Indiana a couple of years ago for an initial community meeting to talk about building a coalition and what the community needed. And this picture was taken about 10 minutes before the meeting started, and there ended up being over 120 people at the meeting. We even had like church ministers at the meeting, and you know, and it was really quite overwhelming and you know, very exciting to see the people who really came to make sure that there was like multi-layered breastfeeding support in their, you know, in their, you know, in their place, in their space. So, do we have any questions? I invite you to ask questions. I would love for you to ask questions. But as I wait for those questions, I will do a little bit of housekeeping here. And this gives you the link to obtain CME credits for this webinar. There will be a CME evaluation and a post-test. And if you have any problems, please contact the executive director at Indiana Perinatal Network, Julia Hogan, and there's her email address and her phone. I'll leave that up on the screen for just a minute so that you have time to copy whatever you would need. And I will also invite you to attend the last of this series call. So this is the end of EPIC. And we're really excited about this call because this is Dr. Amanda Dornfeld from Columbus. And she is going to talk about incorporating breastfeeding practices into your, or breastfeeding care into your practice. And she is just done a great job in her own practice of doing this. And so I think that she can give you some really good ideas for how to do this. I see we have a question. Becky, are you seeing the questions? Because I am not.
Yes, so the question is, how would we go about starting a drop-in center?
Oh, okay. Well, there's a couple of things. I would contact a few community players, see if you can find out about coalitions by checking the Indiana Perinatal Network website. So that's a good place to start, because if you contact a coalition, they're going to have multiple people on their coalition that would have ideas about who could help. Some doctor's offices are doing it, right in their office in waiting rooms during certain times. Sometimes you could contact the hospital, you could partner with them. If the hospital is working on QI, a lot of these hospitals have task force. So you might want to tap into the hospital task force to tell them that you want a drop-in center in your community, and really get a group together to partner on seeing how to do that. Some communities have different people volunteering to do it. Some communities will go through their local hospital. If their hospital is a nonprofit, they can write a small grant for community benefits and actually pay their people that are doing it. So there's a lot of different models, and I would totally invite you that if you wanted more detail, you could certainly contact me because there's just, I've seen so many models for doing this. I think there's one more question.
Sorry, I had to unmute myself. The next question is unrelated to the topic itself. A copy of the PowerPoint, unable to click the actual links on the screen. So what we have done is we are recording today's session, and we will post it on the Upper Midwest Telehealth Resource Center website, so you can view the session. Another email is going to go out shortly after we finish the session this afternoon for the CME links, and that should take care of those questions.
Can you type up my email? Can we type up my email so that they can just, they could contact me directly at Indiana Perinatal Network or the general mailbox at Indiana Perinatal Network as well, and we can share these slides with them?
Sure. So TCARDARELLI at Indiana
perinatal.org.
Perinatal.org. Okay, so I've answered this question via text. So anybody that sees, I'm just making sure I spelled Cardarelli correctly. Okay, so anybody that has the Q&A can look at that, and it should have your email address, Tina.
Very good. Well, I think we have arrived at the 1 o'clock hour and we've used our time wisely. And I thank you very much for joining this webinar and for understanding the importance of this topic and for this work. So thank you again.
Thanks, everyone. Have a great day.
Okay, bye-bye now.